Hi everyone, welcome back to Echo to Fluency. Today's shadowing practice is about visiting a doctor. You'll practice explaining symptoms like cough and fever, talking about body parts, and understanding simple medical questions. Remember, doctor speaks once. When the patient speaks, that's your turn to shadow. Listen, repeat, listen again. Let's begin.
Good morning. Please come in and have a seat. What seems to be the problem today?
Good morning, doctor. I've had a cough and a fever for the past 3 days. Good morning, doctor. I've had a cough and a fever for the past 3 days.
I see. Is it a dry cough, or are you coughing up mucus?
It started as a dry cough, but now I'm coughing up some mucus. It started as a dry cough, but now I'm coughing up some mucus.
What color is the mucus? Is it clear, yellow, or green?
It's mostly yellow. It's mostly yellow.
All right. Have you been experiencing any other symptoms? For example, sore throat, headache, or body aches?
Yes, I have a sore throat and some body aches, especially in my back and legs. Yes, I have a sore throat and some body aches, especially in my back and legs.
Do you feel any chest pain or shortness of breath?
No chest pain, but I feel slightly short of breath when I climb stairs. No chest pain, but I feel slightly short of breath when I climb stairs.
Have you measured your temperature?
Yes, it was 38.5 degrees Celsius last night. Yes, it was 38.5 degrees Celsius last night.
That's considered a mild to moderate fever. Have you taken any medication?
I've taken paracetamol twice a day. I've taken paracetamol twice a day.
Has the fever gone down after taking it?
Yes, it goes down for a few hours, but then it comes back. Yes, it goes down for a few hours, but then it comes back.
All right. I'd like to check your throat and listen to your lungs. Please open your mouth. Good. Now, take a deep breath in and out. Again, please. Your throat looks slightly inflamed, and I can hear some mild congestion in your lungs. It sounds like a respiratory infection.
Is it serious, doctor? Is it serious, doctor?
At this stage, it appears to be a viral infection. You'll need rest, fluids, and medication for your symptoms.
Do I need antibiotics? Do I need antibiotics?
Not at the moment. Antibiotics only work for bacterial infections. If your symptoms worsen, come back for a review.
Okay, I understand. Okay, I understand.
Make sure you drink plenty of warm fluids, get enough sleep, and avoid cold air. If your fever goes above 39 degrees, seek medical attention immediately.
Thank you, doctor. I'll follow your advice. Thank you, doctor. I'll follow your advice.
Great job today. Medical English is extremely important for daily life. If you repeat it confidently, you're improving. If it felt difficult, even better. That means you're growing. Practice this again tomorrow for fluency. See you in the next episode of Echo to Fluency.